I'm Dr. Brad Schwartz. I'm professor of urology at Southern Illinois University School of Medicine. My specialty area is minimally invasive surgery, endourology, laparoscopy, and robotics of the kidney. What attracted me to urology and endourology, minimally invasive surgery, first of all, urology because of the patient satisfaction. I always tell people there are 4 things that I went into urology for, and to not to get too in depth, but patient satisfaction, the quality of life and things like that, the ability to use your hands and operate and perform procedures and things. But specifically endourology, again, when I decided to go into endourology, it wasn't nearly what it is now. And I just had a knack for it. It came very naturally to me, and it was something that I just really, really enjoyed as a resident. And when I chose to do a fellowship in endourology and laparoscopy, it was because that is just truly what I enjoyed. It was something that was very exciting, very easy for me to do and acquire skill and learn how to do it. And then when robotic surgery came on board in the early 2000s, it was just a natural segue. It fit. Again, it was something that I think came very easy to me. I didn't have a lot of acquisition hurdles and things like that. But by the same token, every case is still challenging, and every patient is different. But the subspecialty of laparoscopy, endourology, laparoscopy, robotics is still, to me, the greatest subspecialty in the world. It's just a lot of fun. I think the scariest part of being a patient is the unknown. It's facing a disease or a problem that they may have never faced before. Some of these patients are younger, and when they're in the prime of their life and they are confronted with a problem or disease, it's almost like hitting a brick wall. And so a lot of it is the unknown. A lot of it is they're scared, they're anxious, and there's a whole list of emotions that must be going through patients when they're confronted with disease for the first time or even multiple times. We're not perfect, and we're not, we're not kind of on this pedestal and this high horse of, I can do no wrong and I'm better than everybody else. We all have patients who are incredibly gifted and incredibly accomplished and very, very intelligent, world travelers and inventors and scientists, and we have farmers, and we have hardworking people and families, and they're all just like we are. And I mean, for me personally, over 20 years of taking care of patients, we're all the same people. Just my skills and abilities are just different than theirs. And when I get done taking someone's kidney out, I might have to go to them for something else. And that doesn't make one of us more important than the other one. Educating patients and their families, I think, is crucial to getting them through their process that they're about to go through. That is, I think, what we're all about, at least at SIU, is education is a very, very significant philosophy at our university. We not only educate medical students, residents, and physicians, but I think patient education, family education is crucial to getting them through these difficult times. So not only do they become familiar with their disease, they become familiar with how to manage their disease, how to get it better, and perhaps how to be healthier in the long run. So education is a fundamental component of our treatment of patients.